She says, so I don't need your funding.
we're, we're live. I want to say thanks and welcome to Integrated Indiana Health of Indiana's 7 o'clock talk. I got tongue-tied. Tonight we're going to talk about what we're passionate about, which is why functional medicine and why you should choose functional medicine, and then why we're a good fit for a lot of people. So why us? And actually, I'll just let Jessica start off by talking about functional medicine and why to pick functional medicine.
I'm not a good person to ask because I'm not nice.
But you can soften it. Floor's yours. Hi, Kath.
Well, we just don't believe in the medical model. And I'm a nurse, and I don't believe in the medical model.
Well, I wouldn't say the medical model. We just don't think medicine should be first.
Medicine has a place. Surgery has a place. Treatment has a place, but not 100% of the time.
So let me ask a question. If we have the best medical care in the world, and we have one of the best medical systems in the world, why do we have some of the poorest outcomes in general health, overall health, longevity, and things like that in the world? We're in the bottom quartile. And that's because we don't look at health. So why functional medicine? Because functional medicine puts your health in your hands. We don't dictate health. We help you discover what is wrong and then how to become more resilient. If you've been following us for the last few weeks, you know that her mother is having her own health issue. And just tell the story that you just told me about. I don't want to say animosity, but
I'm a little irritated by it. Well, my mother, if you've been following us at all, my mother's been sick for a very long time, but got down to 77 pounds or something like that. I don't even remember now, but 70 somethings, too small. So a GI doctor who's supposed to be a specialist, actually several doctors basically threw their hands up and said, we don't know what's wrong with you. We're doctors, but we can't fix you. We don't know how to help you. But then they could always find just one more test to do, which was a test. And last week you heard me talk about how she was so excited because she found out what was wrong with her. And she had SIBO, which if you've followed us for any links, you know that is a overgrowth. And that is usually the product of a poor diet and lifestyle. But
overuse of antibiotics.
But nobody seemed to care that she was 70 pounds. And basically just told her to stop eating everything but her protein. And which anybody that knows anything about protein, that's kind of like the keto diet. And she just kept getting smaller because she just didn't have enough anything. Anyway, today, so this is my frustration today. Nobody called her when she was sick and wasn't able to gain weight. But they called her now. This is the fourth phone call trying to get her to take the antibiotic. That basically, if she doesn't take it, they act like there's just dire consequences. But, 70 pounds, isn't dire enough. So today they called her wanting to know if she had gotten her prescription. And she said no, but Medicare didn't approve it. And she's like, oh, that's okay. We'll find funding for you. And then my mother's like, she's finding her voice. And I think that's a journey. Everybody's on a journey.
Well, she has the energy now to talk and think.
And she knows a little more. I guess you just don't know what you don't know. And now that she kind of knows, has been enlightened, now she asks a few questions and feels a little empowered. So today she was approached by the physician, actually called her and wanted to know why she wasn't taking those antibiotics. And then my mom just asked a question and she said, well, what bacteria in my system is overgrown? Well, I don't know. This is what she said. She doesn't know. And she's like, well, then how do you know how to kill it?
For those of you that don't know the medical field, you can have gram-negative or gram-positive bacteria. And if you don't know what you have and you use the wrong drug, you can actually make things worse, which is why we see people go on antibiotics over and over.
Well,
and
that's
over
her
again.
problem. That's basically the problem. And she has UTIs all the time. So she overused antibiotics. Truly overused antibiotics. She also has a brother who has an autoimmune disorder, which is irritable bowel, Crohn's, whatever, who got prescribed more antibiotics than anybody should have ever taken and ended up with 2 bouts of C. diff, which the last one was almost fatal. And he ended up getting 2 fecal transplants. And basically they told him if the last one didn't work, he was probably going to die. And so my mother doesn't put that together. And I'm like, no, you can't take this antibiotic. You're just going to wipe out the gut bacteria that we've worked so hard in the last 6 months for you to grow. And so now she's getting a little feisty. She actually gets out and drives and goes and does. And
she was homebound. Like,
yeah,
she wouldn't get off the couch.
2 feet in the grave. Looked like she was a corpse. And now she's getting her sass back. But she let the doctor have a little sass today and just asked questions, which was questions that anybody should be able to ask any doctor and get a truthful, honest answer. But she always gets, why do you need to know that? It's not important. Well, it is important because, one, she asked the question and it deserved an answer. But what bacteria is in my gut that you think I need to kill? It's just a simple question. Well, I don't know, it doesn't matter, is not an answer. And she's like, well, my son-in-law and my daughter said it is important. And so they did just one more test, which was a test to see if she had pancreatitis. And I was like, Mom, and I get that I'm come from the medical world and I've walked in the hospitals for 12 years. So I got a lot of knowledge, but I'm like, if you actually had pancreatitis, one, you wouldn't be able to eat because it would be so painful that you would be laying in a hospital bed with a Dilaudid pain pump, pushing it every chance you got. Like, you wouldn't be eating, you wouldn't be walking, you wouldn't be going to therapy. So in my opinion, that was just a wasted test. However, we've done a test on her and we're waiting for it to come back because it's actually DNA based. So we'll figure out what her overgrowth is. Well, it's going to come back a train wreck and we kind of expect that, but we kind of have to show her so that she understands what it is we're doing. So, and that's a pretty personal one. But then myself, it's not a short process. Like for myself, it's been 4 years, but we've just
solve a problem.
The tests get better and better and better and better. And the more you do, the more layers. It's like an onion. You peel back the layers to try to find the problem, but you kind of put the layers back when you find the solution. So when you layer up all of the tests, then they kind of lead you to this beautiful root cause, and then you treat that.
So functional medicine is truly, it's not even medicine, it's just health. Our purpose as Integrated Health of Indiana is not to have you on lots of supplements. We don't want you on drugs. We want you in control of your health. It's just like Jessica. The stuff that's helping Jessica right now, she's doing supplements, but that's not actually what's helping her. And it's not me adjusting her that's helping her. The dry needling and acupuncture is probably helping her, but we use other practitioners to help. And so now we're doing
Yeah, but we found that by not conventional ways.
Yeah.
We literally was a pivotal point. Just so happened it all came together at the same time. Is we did the GI map and the Omnix, which is the nutrients and then the bacterias. But we went and had a thermography, full body thermography, which it was really validating to me to know that I know my body. and I could see everything that I complain of on this scan. And then when it came back uh, clogged and congested lymph nodes, which made perfect sense. But it was hard to find a practitioner, and what I really needed was for my lymph system to function properly. But I didn't need a lymph massage. But what I actually needed once I got there, and I found her kind of, I say it's God thing, but I found a beautiful practitioner that does therapeutic massage. And there's nothing therapeutic as far as relaxing about it. But I've been in a lot of car accidents. I've had multiple abdominal surgeries, and apparently I have tons of scar tissue. So she's doing a lot of myofascial release, which I got my neck back. I have a jawbone. I have a shape, and I've seen her twice.
Go back a couple of weeks and just look at the difference in the morphology of her face. And that's why functional medicine, because it's fascinating and it helps no matter what. Now, I am kind of the mind that we want to see people early, because the earlier we catch you, the less you need us. And that's ideal.
Yeah, and you're not meant to be tied to us. We want to get to your root cause and help you live a better life, and then move on with it.
Yeah, go live a good life. And if you have something else that you can't take care of, okay, then we run tests again, we figure it out, and we move on. That's the whole idea. The whole idea is to give you independence and to give you, what am I looking for? Authority over your own health.
Well, you kind of drive the train.
It doesn't come from some doctor's script pad. You don't have high cholesterol because you have a lack of statins. Your body doesn't even make statins. You don't have a headache because you lack acetaminophen. You don't have a headache because you lack ibuprofen. And that's the marketing, and television has just destroyed the independent thinker that used to be in America.
Well, we're treating symptoms.
Yeah.
And
it's whack-a-mole. And then, so why us? That's our purpose. Our purpose is to give you, it's like parents. Your job as a parent is not to lord over your children. Your job as a parent is to prepare the child to move on without you. And that's what a doctor is. A doctor is a teacher. You've heard me say this from video one. It's a teacher. And I am also learning. I have patients bring stuff to me all the time. Hey, have you heard of this? Have you done it? No. And that's why you want us is because we're curious.
But yeah, we don't know everything.
We don't stop.
But we're always seeking.
Yes.
And I've come from the medical side of it, and I absolutely love health. I absolutely am fascinated by this. This is just it, but it doesn't. We aren't the center of it.
No.
Like, we're just a tool, and we kind of give you the tool. So until you're ready, you have to do a lot of changing in your lifestyle and your diet. But those are the key things, and you kind of own that. That's just hard work for some people, and for some people not. And some people look at it as a sacrifice, where, like, for food or diet, and it's just a lifestyle for us. But we bring in all kinds of tools: chiropractic, acupuncture, dry needling. We've used reflexology, thermography,
IVs.
Therapeutic massage, IVs, Reiki. There's all kinds of stuff.
And we're developing, especially locally, resources and practitioners that help. I mean, we're both driven by quality. We like quality things. We don't look for the quick fix. Our question is not how do we fix the headache? Our question is, why the headache in the first place? And if we take care of that, because if you just fix the headache, well, that's like going outside and going to your ditch and you put a bunch of blocks in to block the ditch. Well, eventually the water's going to back up and it'll find a way around. your body's no different. Whatever the inflammation is, it's going to find another path. In the beginning with her, it was headaches. Headaches went away. And then all of a sudden, the next thing was, is this a continuation of? No, it just seems like, we get a little older and things don't work as well, but you can fix it. And that's the whole idea. So we've preached enough. I do want to say thank you to the patients that are talking to their GI docs. We're getting referrals from other doctors. We're getting to help more people. Our email is starting to get more and more questions. We love the questions. Thank you all, and have a blessed and wonderful night.